Hello, my name is Alison Creighton. I'm the Macmillan Radiotherapy Specialist Radiographer in the Arden Centre at University Hospital, Coventry, Warwickshire NHS Trust. Welcome to the Living Well Beyond Treatment radiotherapy session. Radiotherapy is the use of high energy radiation to treat cancer. It is used to try and cure the cancer completely, curative radiotherapy. It is often used to make treatments more effective. For example, it can be combined with chemotherapy or surgery. Radiotherapy is used to reduce the risk of cancer coming back after surgery. We call this adjuvant radiotherapy. Radiotherapy is used to relieve symptoms if a cure is not possible. And radiotherapy is generally considered the most effective cancer treatment after surgery. But how well it works varies from person to person. Radiotherapy generally happens in main cancer centres, not small local hospitals, and this is generally due to the cost of the equipment and the resources and skills of the staff that are needed. We know that radiotherapy causes damage to cells, which then makes it difficult for them to repair or reproduce. This damage can cause short or long-term effects. Radiotherapy can be given as a single dose or, more commonly known, as a daily dose or fraction. Mostly, the total dose is divided into days or weeks. We do this in order to preserve surrounding normal tissue and reduce the side effects of treatment. An area treated with radiotherapy usually receives a lifetime dose, and this generally means that you can't have radiotherapy again to the same place. All cells within the treatment area are affected by treatment, but radiotherapy is planned with the aim of preserving as many normal cells as possible, whilst damaging the tumour itself. Normal cells have a greater ability to recover the cancer cells, but they do sustain damage which cause the side effects. We generally classify side effects into those short-term and long-term. It is very important to prepare patients before treatment so they know what to expect. We call this prehabilitation, and the idea is to make the patients match fit and ready for treatment. Short-term side effects. These are generally called acute side effects. They're side effects that can happen on treatment, but generally settle about 2 to 6 weeks following the end of the treatment. They very much depend on the area being treated. For example, if we're treating the skin, redness will appear with dry or moist peeling or itching. We generally advise skincare with a moisturising cream, but we do all we can to try and prevent this happening. For areas we're treating the mouth or the nose, generally you could get irritation of the mucosal lining and soreness, so we would recommend good oral hygiene and mouthwash. For example, if we're treating the head, patients may experience nausea, dizziness, and some hair loss, which can be permanent. If we're treating anywhere in the chest, general side effects are cough and breathlessness with swallowing difficulties. We very much require dietetic input to help you cope with those side effects. When radiating the abdomen or the tummy, very commonly people feel sick. They can be sick and vomit. They can get stomach pain. Generally, we use medicines like loperamide to help with this, or anti-sickness drugs. In the pelvis, you can get a change in bowel habits, which often results in diarrhoea, and you can get some urinary symptoms such as cystitis. Most patients will suffer with fatigue in any shape or form. A change in appetite and weight loss is very common on radiotherapy treatment. Late effects, or more commonly known as chronic effects, can appear months or years following treatment. Due to better treatments, we know that increased survivorship means that people are living longer with these late effects, and they're more commonly occurring. These late effects are defined as the consequences of cancer and its treatment that manifest either during or after cancer treatment and persist beyond the end of treatment. And we know that people don't stop feeling these side effects even when treatment's finished. The risk of getting late effects from radiotherapy very much depends on several factors. The type of treatment, for example, did you just have radiotherapy alone, or was it combined with surgery or chemotherapy or immunotherapy? Have people had previous treatment? How long ago? How much did we treat you? What was the dose? What was the overall treatment time? How big was the area we treated? That usually the bigger the area, the more likely you are to get side effects. Where are we treating? Where are the critical organs? What's close by? How old are people when they have their treatment? Obviously, children that are treated have a much longer lifespan and will more likely get side effects. For any comorbidities that patients have as well, like diabetes or heart disease, lifestyle factors, including smoking or drinking, contribute to the late effects. Exercise, as we know, is good. The consequences of treatment. As we know, the consequences of treatment is an exhaustive list, very much depending on where we've treated, as I've said, how long the treatment lasted for, the area we treated. But I've listed some of the side effects. And we know very commonly, fatigue we've mentioned, change in weight, change in bowel habits, lymphedema, change in sexual function, which is a really important topic that, a lot of us don't ask enough questions about. People's physical appearance after treatment. So all of these things, profound effect on people for a long time. The emotional side of things that that again is an exhaustive list, and we know that those go alongside things like anxiety and depression and low self-esteem and worry about the future. So importantly, when you attend for follow-up appointments after your radiotherapy is completed, it's really important to prepare and to know what to tell your clinical team. For example, at each visit, mention any health issues that you're having, any new symptoms that you think are important, any pain or discomfort that's troubling you, any physical problems that get in the way of everyday life for you. What bothers you most? Other health problems that occur during the time after your treatment, such as heart problems or diabetes. Any medicines that you've started to take, or over-the-counter remedies, herbal treatments, these are really important because they can impact on some of the medicines that you might be prescribed. Any emotional problems that you're having, any fears and anxieties or depression, really important that we need to know. Any change in your family's medical health, for example, any relatives being diagnosed with cancers. Come prepared with a list of questions that you want to know more about. For example, have you read something in the paper, any research or trials that you're interested in? And just because you have symptoms, it doesn't mean that your cancer's come back. Often it's a consequence of treatment. That's so important that we know about that so we can help you and signpost you in the right direction. Always, in between appointments, if you have any concerns, discuss this with your own GP. So what's happening? What's being done about managing these late effects? Radiotherapy is progressing all the time. Very research-based evidence is used to try and improve the techniques and the way that we treat you in order to reduce the side effects of treatment. Late effects of radiotherapy can be difficult to diagnose, and management of this can be complex. Sometimes more damage can be done to the area that we treated by inappropriate investigations. Experience suggests that such patients have reduced quality of life and their complex needs aren't always met. National Cancer Survivorship Initiative developed the Recovery Package, which is a building block for achieving good outcomes. It promotes self-management and helps survivors to live well and beyond their cancer diagnosis. The Recovery Package, which I'm sure one of the other speakers will talk about in more depth, is working towards delivering a better care package for you in the future. In terms of radiotherapy, what we're trying to do is manage side effects better. We know that they happen, and we know that patients struggle with these things many, many years after treatment. We're looking to establish late effects clinics, and some of the major hospitals are doing this already, and developing a team of those with a special interest in managing radiotherapy. If you feel you'd like any more information about radiotherapy or any information about late effects of radiotherapy, please don't hesitate to contact us on the number on the screen. Thank you.